Our country is also grappling with an opioid epidemic. Last year, 2,800 Canadians died, their deaths connected to opioids. And the number of overdoses is rising every day in every part of the country. In Ottawa, healthcare workers are trying a new approach to help save lives, fighting fire with fire. Susan Lunn has that story from the streets of the capital.
A weeknight in Ottawa's Byward Market. As people walk home from work,
you have safe supplies for people?
Yeah, I have the nasal and the injectable.
The frontline staff at Shepherds of Good Hope are getting ready for the night shift.
Everything okay?
It's a constant patrol. Every day, every hour since the summer.
And if you need anything.
When I first started here and we would do grounds checks, if we saw people, let's say, using, we would tell them, like, take it off property. And then we started realizing that that's a danger, as Daniel was saying,
They could die off property.
Because they could die if they're by themselves.
For months, fentanyl has been a crisis in Western Canada. But the drug arrived in the nation's capital in a big way this summer.
Are you okay right now?
Overdoses went from 4 a month in June to 4 a day by October.
Stick around here.
1 week we weren't dealing with that stuff, and then the next week, all of a sudden, just like 5 overdoses in 1 week. Really just came out of nowhere.
So in September, healthcare workers started giving a small number of addicts clean drugs, a prescription opioid, choosing to help them get high safely rather than watching them die.
The circumstances of the last 3 or 4 months have changed our lives.
Dr. Jeff Turnbull left his job running the Ottawa hospital to head up this program to help addicts. At first, he thought supervised drug injection sites were the solution. Today, he says they're nowhere near enough.
They're bringing in drugs that are laced with fentanyl. So the thought would be that if we're going to have supervised, safe injection sites, why would we allow them still to inject poison?
7 people who come here are already getting the intravenous opioid.
Thank you for cleaning up your stuff, guys. Appreciate it.
Frontline workers are hoping to get that up to 40 by next month. Those who have seen friends overdose think it will save lives.
If it were an English perspective where the government could supply it, then at least they would know the dosage, you know, and not gamble with their, like, play Russian roulette every time they want to shoot up.
Coming around again, guys.
And that's not all it does for addicts.
Give them resources and time to work on themselves and work on getting better without having to go through withdrawal every day and feeling sick and not being able to accomplish anything because you're looking for money on the streets to get high.
An extreme response to an unprecedented crisis.